Just wanted to hop on here and just share this beautiful graphic. You can find this graphic and lots of other good information about the neck and its contribution to dizziness, but we're also going to talk about why the neck can impact so many other systems. So we're starting over here and we have neck pain, inflammation, or some type of injury coming to the upper cervical region. So this is your C1, C2, and C3. And this is going to affect the way that mechanical receptors in the neck, particularly from the joints and the muscles, are going to fire as it goes up into the cerebellum for one and the vestibular nuclei for the other. But look what else meets the vestibular nuclei. You have the neck, and you also have the vestibular organ itself, which is where people can get vertigo, and you also have your visual system. So it's the job of this vestibular nuclei to basically act like an arbiter of all of these senses that are firing into the brainstem. So then the vestibular nuclei goes into the thalamus, and the thalamus is like a relay center. It's going to send it up into the brain itself. And the way to describe what happens is really beautiful. So you talk about subcortical and cortical maladaptive reorganization. So the brain has to rewire itself to its environment based on the information that is coming in from the neck, the inner ear, or the eyes. And if that reorganization is faulty, meaning you have erroneous weighting strategies, then your brain loses trust in some of its senses. And depending on which sense it trusts, and if it's inaccurate with the world around you, you get something called a sensory mismatch. This sensory mismatch problem is one of the core theories behind how dizziness can affect things like nausea and motion sickness and a lot of other consequences that come whenever someone gets dizzy. But here's something that gets underestimated. So the vestibular nuclei is also going to fire into something called your reticular formation. That reticular formation is going to mainly be responsible for a lot of our postural responses, especially our conscious postural responses. But that reticular formation is also going to be the home for a lot of brainstem nuclei that house things like norepinephrine, which is really important for our levels of awareness and consciousness, and it's also driving our sympathetic nervous system responses. So it could have impact on our autonomic nervous system, our limbic system, and I haven't heard this term before, but neurovegetative symptoms, I'm guessing that has to do with our level of arousal and awareness. So when people ask why the neck can cause all these wide variety of problems and why correcting a problem in the neck can actually lead to a resolution of many of these problems, then these are the pathways that I'm frequently referencing whenever I do my lectures, but also when I go and talk to patients.